the stigma is still the problem in South Africa.
What makes it more complex is emergence of the so-called drug-resistant strains, which mean that one needs to take new sets of drugs called second-line drugs, which may take longer to treat. But also what complicates TB is also co-infection with HIV. When people are immunocompromised, particularly if they are not taking treatment, TB becomes one of the most opportunistic diseases.
Digital health tools and community-based care is improving case detection and treatment linkage.
Simple tongue swab to extract sample in patients or people who are not able to produce sputum, like children and some adults with other conditions. The exciting news about M72 vaccine that's in clinical trial and is promising really that in the next couple of years we could have a rollout for that. South Africa, for instance, has seen a drop in TB incidence rates up to 59% reduction, as well as 16% reduction of TB-related deaths. But to be honest, those are not sufficient enough to say we are on target to reaching the goals of end TB strategy. So more needs to be done, but there's also hope. So we need to celebrate milestones while we need to do more.
So if we've got conference, that's where we meet other researchers, other community people who are involved on working on TB.
TB is one of the major burdens of public health systems, not only in South Africa, mainly in sub-Saharan Africa and Southeast Asia. And in fact, it's responsible for more deaths than any other infectious agent.
Youth play a key role in reducing stigma and promoting early testing and treatment.
It's a disease that affects people of all generations, but the youth in particular should know and understand the challenge to be able to design solutions for such. So it equally affects them, and it's very important to them looking in the future. The Center for TB Research, SAMRC, which is on Stellenbosch, first, it celebrates the partnership that existed between University of Stellenbosch and MRC as one of the first units, but it's also addressing a critical issue that is within the burden of disease in the country, for which MRC has a mandate to the country to add to the TB control programs. So having 55 years of excellence in research and adding to that mandate, it's already a great milestone. We also have studies that have shown that you can use blood-based biomarkers that could in future be used for point-of-care diagnosis for TB. The importance of the South African Medical Research Council as a funder, but also as a custodian of visions and mission that is actually meant to help South Africa's government to control TB is also being phenomenal.